everybody, and welcome to our third webinar about Flex Program Evaluation. Today, we'll be talking about accessing and analyzing data for decision-making. My name is Tracy Morton. I'm the Director of Population Health at the National Rural Health Resource Center, which is the technical assistance provider for the state Flex programs, as well as the SHIP programs, which I know many of you also serve on today. Our organization, the National Rural Health Resource Center, is a nonprofit organization that's dedicated to sustaining and improving healthcare in rural communities around the country. Our work falls into the program areas you can see there on the screen. And this is possible through funding from the Federal Office of Rural Health Policy. And it's a joint effort between the Technical Assistance and Services Center, or TASC, at the National Rural Health Resource Center, and the Flex monitoring team too. So we're really excited about the collaboration on this topic. If you participated in any of the other previous webinars, you know that really the purpose of this webinar series is kind of a quick course to help deepen the understanding of the state Flex programs about program evaluation. So we've talked about a couple different topics already, and those include kind of understanding some of the basics about program evaluation. Then last time we talked about understanding theory of change and logic model. Today, we'll be focusing on data and using that data to not only figure out where to find it from, but how to analyze it and then move forward with that analysis to make decisions about program activities and projects and direction. And then we'll be rounding out our series where we'll really be digging more into designing activities and having a robust work plan where you can demonstrate impact of what it is that you're trying to achieve. Each of these webinars is 60 minutes. So we have a presentation by the Flex monitoring team with a little bit of ad hoc support from TASC, and then and some engaging questions for you all as we move through this. And then the latter part of our call today is spent with conversation or activity with all of you. Today, we're really excited to have Megan Lahr leading. Megan's been on the previous two calls too, but we were mostly hearing from John Gale there. But the two of them represent different organizations in the Flex monitoring team, which is a consortium, I guess, of different universities, 3 different universities that make up that entity. So Megan, I'll turn it over to you to talk a little bit about the learning objectives for today.
Perfect. Thanks, Tracy. Like Tracy said, I'm Megan Lahr, the principal investigator of the Flex monitoring team, and I'm based at the University of Minnesota. Today, the learning objectives, we have a few here that we'll be running through. First, we're going to give you examples of where you can access data that's readily available. So for each of your state Flex programs, what's out there, where can you find things that are most applicable to you? Look at how you can interpret how to look at the data and identify needs for your hospitals and facilities. Translate that identified needs. So once you know what the needs are, how can you translate that into designing activities, and really recognize the power of cohorts, using smaller groups of your facilities to track and use data.
So all of this ties back into the core competencies that were set up. So there are a set of core competencies for state Flex program excellence. If you have a well-rounded, robust Flex program, among not only your staff within your organization, but also those that you partner with, those that you subcontract with, then you are felt to have a really excellent program. And within there, there's a set of competencies, and those competencies then all have proficiencies that tie to them. So some of the competencies are really obvious about how they relate to evaluation. Like the one there on the screen, managing information and evaluation is a core competency of state Flex programs. And within that, I've highlighted 2 of the proficiencies that really tie directly to what we'll be talking about today. Being able to access and analyze data for decision-making, the title of today's webinar, and being able to ensure that the data reporting deliverables are built into your contractual agreements with consultants. We've talked about that in the recent past, and we'll be certainly talking about it more today. There's a few other core competencies that really talk about data specifically in them. So I wanted to highlight to you what those were and what those proficiencies are. So in strengthening quality reporting and improvement, one of the required areas within the Flex program too, there's 2 proficiencies that talk about data. One being able to utilize those Medicare beneficiary quality improvement projects, or MBQIP reports, that are provided to you by the Flex monitoring team to look at the data there and see what's going on. And then being able to understand each of the MBQIP measures, the purpose of them, and the data collection methodology. You don't have to be an expert in it, but you at least need to be able to be somewhat fluid and aware of what's happening to be able to pinpoint where there's maybe issues or opportunities. Another core competency of the Flex programs is to improve financial sustainability. So of course, related again to data and that financial data. So being able to understand how critical access hospitals financial data is reported, analyzed, and acted upon. Again, you don't need to be super in-depth expert, but you need to be aware of what happens within this. Flex programs should be proficient in describing what each of the most important critical access hospital financial measures are, and how they impact hospital financial performance and opportunities. And then it's also important that you're able to analyze the hospital's financial performance over time and identify hospitals in financial crisis. And there's some great tools that exist to very readily access that data. There's two other core competencies that really directly relate to data specifically set in their proficiencies. One is understanding the current and future healthcare environment, and that a Flex program should be able to identify the varying needs of their independent or system-affiliated CHs, their CHs with provider-based rural health clinics, long-term care facilities, or owned ambulance agencies. So you can collect that information or understand those needs in a variety of different ways. And sometimes it's data that we can actually count, or sometimes it's more qualitative data that we describe to one another. And then the last core competency is about addressing community needs. And within that, there's data that you can readily access about from community health needs assessments, from COMPASS, or the Critical Access Hospital Measurement and Performance Assessment System, or other sources, and then being able to utilize that data to make decision-making, to have your program provide projects that help your rural hospitals and address those community needs. So that was a whole lot of information there, but what we're going to do quick here is put up some polling questions, some pre-polling questions that help us get a good lay of the land. So on your screen, you should be able to see the first set of polling questions here. And there are 4 questions up. So the first are just some basic ones related to the competencies, or excuse me, the learning objectives for today. So please respond to this about what your level of knowledge is about where you can access data that's readily available to your Flex program. Your knowledge about how to look at data to identify needs, how comfortable you feel like with that. Your knowledge about using the power of cohorts to track and use data. And then the 4th question there in that set of polling is your knowledge level about how to translate the identified needs into designing activities that can be implemented by your state. So take a few minutes to answer those questions, and Caroline, I'll ask you to kind of display those quickly on the screen. We'll talk through some of the results before we move to the next set. Great. So what it looks like is that the majority of you are feeling either confident or moderately familiar with where to access data. So we hope that we can help you a lot with that today. And similarly, I'd say the majority are feeling moderately or maybe even slightly familiar about how to look at that data to identify needs. Most of you are feeling moderately familiar about the knowledge or about the power of cohorts and how to use those to track data and to gather data from them. And then the final question right now was how confident you feel with translating identified needs into action, into activities for your program. And most of you look like you're feeling moderately familiar or confident in that knowledge. So great, thanks for taking a second to respond to that. I think if I'm remembering correctly, Caroline, do we have another set of questions right now? Okay, great. If you could put those up, that'd be wonderful. All right, so another set of questions for you, and you'll see those on your screen, 3 of them. Does your Flex program access and analyze data for decision making? How often do you do that? All the time? Every once in a blue moon? The second question is, do you ensure that data reporting deliverables are built into your contractual agreements with consultants? How often do you do that? And then the last question, or you can choose as many of these as you like. What are your biggest challenges for accessing and analyzing data for decision making for your Flex program and for yourself? So we'll give you a couple minutes to respond to that, and then we'll talk through the results there again.
I'm getting some trouble from Zoom on the sharing results, but it looks like, Tracy, there's a pretty even spread between the amount of state Flex programs that are accessing and analyzing data for decision making, with the large majority of them answering that they often or sometimes do that. Okay. And then it looks like most everybody, good news is ensuring data reporting deliverables are built into their Flex program contracts. And then the most common concern related to accessing and analyzing data for decision making for their Flex programs are staffing as well as time. And then there was a pretty even spread between understanding the data and knowing where to start.
Excellent, that's great. All right, Megan, I'll turn it over to you.
Right. So a little bit about the importance of data in evaluation. So data is really essential to evaluation. You need data to see if change is occurring and to document any outcomes you might be tracking. Data really shows, where you're starting and really helps you determine where you should even begin and also where the biggest opportunities for growth are. And so data shows you, how you're doing along the way as well. Are things working? Are there participants engaged? Do you need to course correct and make a change in the middle of a project to adjust and kind of ensure that you're on track to meet your goals? And data also shows you where you end up, what have you achieved, and it really helps you to learn from what you did and see how to improve going forward. And so in the process of evaluation, you'll need to know how to collect data, store it, track it, analyze it, be able to know what the data is telling you about your work and then be able to report it. So share it with others. That might be sharing it with FORP, with other stakeholders in your state, with your participants and your hospitals in your state, and really just generally knowing how to use the data along every step of the way. I think we have a little activity.
Yeah, thanks, Megan. So we're gonna do a waterfall question. So some of you might have participated in this before. I'm going to give the instructions. I'm going to say the instructions again before we see the question to respond to. Because the point of the waterfall question or response is that everybody answers all at once in the chat. So I ask you to open up your chat on your screen if you haven't. If not, it's at the bottom of your screen. There's an icon that looks like a little thought bubble, and below that it will say chat. So you can click on that to make sure that that panel is open for you on your screen. I'm going to put on the screen here the question we want to respond to. It's actually a statement. We'd like you to complete the end of the statement too. Type in your answer into chat, but don't hit enter. Don't hit the little send airplane thing. Type in your answer, but don't hit enter. I will instruct us all when to hit enter, and then I'll go and it'll show all of the responses all at once, which is kind of fun. Okay, so type your response into chat. Don't hit enter yet until I say to do so. So the statement we'd like you to complete is this. Data can help you and your Flex program to do what? So go ahead and type your answer into chat. Okay, data can help me and my Flex program too. And if you want to hit enter, then we'll see all the results that'll come up into the chat space. Hey, that's kind of fun. All right, so I'm going to just breeze through what some of the responses are here. They can help you evaluate for effectiveness. Provide your programs, absolutely, to be successful, improve patient care, understand where there's areas of improvement needed, design programs and improve quality, identify improvement areas, do many things. Thank you, Caleb. Very true. I can help you do many things. Yep. Determine your activities, provide education, determine relative standing versus other states. Absolutely. Yeah. Where are you at? Make some decisions. Understand what you need to continue or what you need to pivot on. Evaluate your needs of your hospitals and see the impact of activity. Great, thanks everybody. So Megan, back to you here.
Great. And so you covered a lot of what I have here, but here's some other examples, and I know this is a little small, but what data can help us to do. So, understand and increase the impact of our work and related activities. So obviously, if you have the data, you can see kind of what that impact may be over time. Improving program efficiency and effectiveness. A lot of you said something similar to this, learning what activities work, how to use best practices and use your own lessons learned via the data. What are you seeing to make your Flex program more effective? Validate program activity and intent. So the last webinar, we talked about logic models and theories of change. You want to be able to use that data to show that an activity is actually working, show that that theory you developed about why something should change, did that come to fruition, or see how you might be able to adapt if that didn't. It'll help you enhance your program reporting. So by identifying what data to collect and what outcomes you'll be looking for, it'll be a lot easier at reporting time, and it'll be a lot more useful information that you're able to provide back, whether it's to FORP or your state or other entities. Support program planning, development, management, and implementation. A lot of you said things like this, knowing where your hospitals are succeeding and knowing where there's room for improvement based on the data. It's really helpful for all of the planning and the management that you're doing, just knowing how things are going. encouraging ongoing program revisions. Again, when you're collecting and analyzing data, you'll know when things aren't working too, until you have a better idea where you can adjust or change aspects of your program. Improving program engagement, collecting that data and sharing it back with your hospitals. You can work with them to directly provide that, to them, to other hospitals as well. Being aware of where their needs are and offering them support in those areas can really lead to better engagement, not just proposing ideas based on, an idea that you heard, but really looking at what they need and engaging with them on that. And telling your story, just overall, it can support your success stories. And it can also help you make the case for needing additional support if you do need that. I think we have another waterfall.
We do have another waterfall, so again, same thing as before. I'll put up the statement there, and if you want to type your response into chat, again, don't hit enter until we do ask you to do so. But we're looking for 2 answers to this. So you can separate it with a semicolon or extra spaces. Just don't hit enter. I didn't really think that through, and I said let's provide 2 things. But so use extra spaces, use some underlines, use some symbols, some emojis, whatever you do to delineate that there's 2 things there. But don't hit enter to get a line break, because then we'll mess up our waterfall. We'll have like a trickling stream and not a waterfall. So what we're looking for here are moving into finding the data. So what are the 2 places that you go to most often to access data for your Flex program? Okay, and why don't you go ahead and hit enter, and we'll see where people go to find their data. So I'm going to guess we're going to have some similar things here, and then maybe a couple little gems that are some great ideas for everybody. So the summary reports from the Flex monitoring team, yay! I'm sure that they're very thankful to hear that too, but they're really, really helpful reports, as well as Compass, and we'll talk about Compass a little bit. Using some internal polling from the hospitals. NIH is a great source of data too. Yeah, great point, Brandon. Cost reports, the population health toolkit. Task has some information and data that we can share with you. Secure file folders directly from your critical access hospitals, their MB-Equip data reports, your contractor reports that they compile for you, the CMS website, that's another great source. Member survey responses, so yes, from your hospitals or other organizations or entities. Let's see. And contractor deliverables. That's a great point there too, Nick. All right, Megan, back to you again.
Great. So thinking about places to access data, there's so many places, and you named a lot of them. But today we're starting small, really focusing on the places that are really accessible to you and probably most relevant and impactful for the work of your state Flex program. And so there are a lot of secondary data sources. So those are data that are collected by someone else. And so there are lots of resources. You mentioned most of them from Flex partners. And so the Compass data that we at FMT put together, similarly, the MB-Equip reports and other yearly reports on community benefit and impact, quality, financial indicators. Soon you'll have data from the CA quality inventory and assessment. So that's another source that we're looking forward to. The center, like someone mentioned, the center has a population health toolkit. You have your PIMS data. So that's data that you collect and submit yourselves. There are also a lot of other national data sources. One listed on here, and all the ones on this slide are linked if you're looking at the slides later, is county health rankings. That's a great source for looking at county level data, nationally, federally funded surveys, and data from other state or national organizations or associations. Maybe your hospital association collects some data. Or the National Hospital, American Hospital Association may have data. There's also a lot of state level data that you may have access to. There are a lot of things that each state puts out publicly that are resources. There's also data that you might be able to get access to as a part of your role. And so a lot of things that you can look for to, surveys, data repositories that might be really applicable to the work that you're doing. And maybe the most important source of all is the primary data you can collect as a state Flex program. And that's the data from your hospitals, from your EMS agencies, from your rural health clinics. And so they have all of the data, and you can get it a lot quicker than you can get it from a lot of these other sources. So don't be afraid to use them directly. We can look at the next slide and talk about this a little bit more. So on the point of collecting the data from your hospitals, why might you collect data from your hospitals? First of all, like I said, it is the most timely way to get data. There isn't anyone in the middle that has to collect the data and analyze the data and repackage it in a way that they can send it out publicly and check it. So all of that takes a lot of time. So all those secondary data sources, they take time to process and get back to you into your hands. So if you collect the data from your hospitals, or if you have your subcontractor do it, it's a lot quicker than waiting for those other sources. You also have the flexibility, if you're asking them for the data, to ask them for whatever you want. And that might be on whatever timeline. So a lot of the data you'll receive from secondary sources, that will come as annual data or as quarterly data, but that might not work best for you. So for example, the Flex program year is September through August. That doesn't directly align with a lot of these other data sources. And so you can collect data maybe monthly or as far as like 3 different months. You can really set up whatever standards you want for your data collection so that you have it. It really aligns with the work that you're doing specifically. You can ask for data in the middle of your project, halfway, look to see how the project is going, but you really have that flexibility. And honestly, when you're collecting data from your hospitals, it doesn't have to be complex. You can ask for just one measure or a component of a measure, one component of HCAHPS if you're working on that. Just to see how things are changing and see what's going on. It doesn't have to be burdensome, but the really important thing is to set clear expectations for that data. And so working with your hospitals for a given project year, you need to make sure that you're setting clear expectations and that you are providing them, you're telling them, I'm providing you with funding for this project, and there's the expectation that they'll provide you with the data for tracking the outcomes that you really want to look for and that you need to be looking for the Flex program. And so some states in the past, they've used like participation agreements when working with their facilities, having each hospital sign something saying, you're showing your willingness to participate in this, and they're acknowledging that understanding that they have to report back whatever data that you're requesting. But consistency is key. Really be clear, be consistent with them, talk with them, have this open communication about what is required, what's part of this, because data is really essential to being able to show that the project has made some change and is really impacting your program overall. So I'd love to take a chance here, and we've asked a few people in advance, but if others have ideas to talk a little bit about how you've collected data or are collecting data from your hospitals. So feel free to come off mute and share your experience. How do you request and access data from your hospitals? I'll let folks jump in, and I can always call in people too. I don't know if we have Scott or Lynette or Sandy that are willing to say something about
this is Sandy from Pennsylvania. Typically how I request and data from our hospitals is I reach out to them via email many times. Can you hear me, by the way? Can everyone hear me? I reach out via email. I'm also, I pick up the phone, I'll call them. All of my hospitals have my direct cell phone number, so they can always call me back and get a hold of me anywhere at any time. But that is typically how I reach out to them and request data. I also do a yearly survey on their needs to find out, from meetings with them. So from the site visits and different vendor or contractor meetings I have with them, I kind of have a very good idea what their needs are, and I put them into surveys to see, okay, we did have some of these needs this year. We have ones that they can select, and then we ask for some open-ended questions that they can write in and give us more ideas about what their needs are.
Yeah.
And I also have had to, because our hospitals can be, they really want to secure their data. I've also had to go into sign some non-disclosure agreements and agree that I will aggregate data for them and not put them out there solely by themselves.
Yeah, thanks, Sandy. That's really important, that collecting information about what their needs are. That's a source of data that you can collect, as well as data from those measures or from whatever you're tracking. Thanks. I really appreciate that. Anyone else briefly before we move on?
So I have a lot of background noise. Similar process in Hawaii too, although we do have regular meetings. Well, one of the ways that I'm able to ask for data is especially along the needs, what do you want types of things, is I have regular Zoom calls with the critical access hospitals, and it's basically a way for me to get some feedback on what's working with the program, but also what are the needs, what's the direction we need to go in, and what are you doing. One of the nice things in Hawaii is that the hospitals agreed a long time ago that they would share data amongst themselves, and at our quarterly reporting, it would be unblinded. So everyone knows how everyone else is doing. So it makes it real easy to put together reports because I don't have to remember A belongs to Molokai or whoever, whatever coding it is. It makes it easy for me on the one hand to basically put those reports together and let everyone know. But the other thing is the reason they sort of decide to do that, if they see a hospital that's doing well, they basically communicate back and forth between themselves. I mean, yes, this is about how do I get data, but one of the things is where they get their information and training and on how to improvement as much as them being able to access the data and know who's doing well also. So when we share the data, it is unblinded. They know who's doing well, they know who's not doing so hot, and it's not, and you know, it's a non-punishment environment. If you're not doing well, we just sort of ask, do you know what's causing dinner? What help do you need? It's a way of basically doing that. So yeah, it's a combination of just asking them directly, and then basically those meetings that we have, those informal or formal and informal meetings that we have. It's a way of basically getting the data that I need to know on how they're doing and where to progress, so, or where to go in the future.
Perfect. Thanks so much. Yeah, and that's a great point. You know, some states have great openness in them, and there's not that competitive nature. Other states have a challenge with showing data unblinded, and so there's ways to do that and kind of get around that. But I really appreciate you showing that. We can go to the next slide and talk a little bit about collecting data. So a lot of you said this is something that you already do, which is great. But another challenge that we've heard from some states is when they have subcontractors working on projects, they aren't able to get data for them. So a couple key tips on this. First, you know, you want to ensure that all of your contracts include the collection of data and outcomes as a part of that scope of work. And not only the requirement to collect these things, but also to report them back to you. You know, make sure you include a note of any specific reports or deliverables that you want them to make, be explicit about what outcomes you want tracked, what timelines, how often, when you want to receive them. You really want to make sure that that timeline portion of the deliverables aligns with what your needs are. So keep in mind when you need to report things for Flex, for other reasons, you know, particularly going into the new Flex 5-year cycle, you know, keep this in mind as you're developing your contracts and the ideas for your projects. And it's not always, you know, only making sure that it's in your contracts, but it's then monitoring them. Are you receiving what you asked for? Are you getting it on time? Are you getting the measures that you wanted? Or, you know, do you need to update something in your work plan? You know, really just if you're not getting those things, that's a problem, and making sure that you adjust future contracts to align with that. And yes, definitely, Tracy says Task is really great at helping manage some of these things and kind of work through how to build those contracts. Contract management is something that Task is definitely able to provide assistance with. We can go to the next slide, and we're going to move to talking a little bit about how do we then use data to assess needs. So it's really important that you select the most relevant data for your state and for your hospitals, and then use the input from your hospitals to inform that work too. So like Sandy and Scott said, you know, we get the information from our hospitals about what they want and what they need, and then really looking at the data to ensure that those are needs and areas and opportunities for growth. Look at what's available and identify those needs for improvement. So where are your hospitals struggling? You know, what do they consistently say is problematic for them? And then how can you find the data to measure things in that area or that topic that they say is problematic? We can look at a couple of examples next on the next slide. So this is, you know, briefly, these are data from MBQuip reports. This first one is from our annual reports. And, you know, sometimes looking at data, things might seem obvious, right? So here, the red indicates that this state's hospitals are performing lower than hospitals across the country. So statistically significantly lower than all other hospitals nationally. So this is EDTC data. So thinking about how do you use data specific to your state, where it shows how you're compared to other hospitals nationally. You can see that this state has some opportunities for improvement. So if you see something like this is really an indicator, not that, oh, wow, I really need to do something in this area, but it's an indicator to look further. So, start asking more questions. This is your state as a whole, but you really want to be able to look at the hospital level data to see if there are some specific hospitals that might be struggling, see if it's an area you might want to invest or investigate or do some work in. And seeing data like this, it's not necessarily a reason to create a topic, but just something that you should be aware of. And on the next slide, we'll look at some HCAHPS data. And so these are showing two different components of HCAHPS, and this is using our quarterly reports. So our quarterly reports are always going to be a little bit more recent because we're not waiting for the whole year's data to come out. What you'll want to do is take a look at these reports. Your state's values are here in red. So you can look at how your state does, and then you really want to compare it to those broader indicators. So in this case, there's national data, the next blue circles, and then the benchmark. So that's the MBQIP benchmark. And so that's already, another example there on the far right. And so you can look to see where might you have opportunities for improvement. So again, this data is a starting point. From here, you really want to take a look at the hospital level data to see how they're doing. So with MBQIP data or with Compass financial data, that's also something that you have at your fingertips. So for all of these values that have state level data, you also have hospital level data for these measures. And so if we can look at the next slide, this is an example of a spreadsheet that you receive with each quarter of your MBQIP quarterly reports. And so this is the HCAHPS one. So again, looking at one of those measures that was on the previous screen. So the state value for this composite 7 was 47%, compared to 55% for cause nationally and 64% for that benchmark. And so in looking at some of these hospitals, so you're going to look at that column F with the always, you can see that some of those hospitals are doing really well. You see at the top there an 82. That's not a hospital that necessarily needs a lot of help in this area for this portion of HCAHPS. But if you look down, you see a 56 and a 49. So just by looking at the data, you can see, there may be some hospitals that are struggling a bit more than others. And so that overall state number that was 47 doesn't reflect all of your hospitals. And so this is another reason, and we'll talk about this a bit more later, but to think about a cohort. So which of the hospitals are really struggling with something, you can see that in the data that you already have access to. So we can take a look at the next slide and talk a little bit about some definitions. And so some of these you've seen before. All of the definitions, again, related to evaluation are in that evaluation glossary, and that's linked on the bottom of this slide. Goals and objectives, we talked about these, I think in the basics the first week, but you want to have these in mind when you're starting to look at data and seeing really where you might be able to make change through your activities. And so a couple of new definitions we have up here today are baseline, which is a starting point to be used to see how far you've come in your project. So this is the initial data that you collect or you find that shows where your hospitals are starting. And this is often the indicator that shows that you have an opportunity for improvement, kind of like those examples we just looked at. And then there's a benchmark. I mentioned this as we were looking at the example data, but the benchmark is a point of reference that serves as a basis for evaluation or from which a measurement may be made. So benchmarks, those might be a set value for cause to reference or try to achieve. And so like those examples, there are MBQIP benchmarks. So another example, MBQIP, the benchmark for antibiotic stewardship is 100%. So the goal for MBQIP is that 100% of cause will meet all of the measurement elements for antibiotic stewardship. Or similarly, there are benchmarks in the Compass financial indicators. So this is a benchmark, it's a high but attainable goal, so that a hospital's cash flow margin is at 5%. That's a benchmark that's set, that is one of those things that you can look for to compare the values of your hospitals to those. And then we can look at the next slide and talk about planning and setting goals. So to plan and set goals, this really highlights how you need to have data starting at the beginning of this process. So looking at some of that summary data, that state data or national data, and then really digging into your facilities data, that baseline data to inform your goal setting. So look for those benchmarks when they're available to help in that process to see where you may not be making that mark. You may not be hitting that the highest level that you can. But also in doing this and setting goals, you really want want to make sure that you're setting reasonable goals. Just because there's a benchmark for that measure, that doesn't mean that your project will be able to get your facility to meet that benchmark or exceed that benchmark, especially within a year. And so it's really important to consider where a facility is starting. So where's that baseline and what might be really feasible for them to achieve throughout the project. And oftentimes it's helpful to think about that in a like proportional increase, so they can increase or decrease, their performance by a percentage in a given time increment. So really thinking about what will help each facility individually and where they're starting and how, what their capacity might be to improve. So you may have 5 hospitals in your cohort in your project, and they're all likely starting at different places. And so really thinking about that they each may have different goals and how those may relate. And another huge reminder, not all outcomes can be achieved in a year. And so when you're setting those goals, you really want to think through, what are my short-term, my intermediate, my long-term outcomes that you want to change, and how long might it take for your hospitals to achieve those goals. And so those are just all things, it's a lot of thinking through, but it's really kind of using the resources that are available to you to kind of think through those things and plan for them from the beginning. On the next slide, we talk about tying needs to activities, and this too, it's all connected. Going back to how can we use the data and then connect it to our activities, we really want to, you start with taking a look at the data, see where those opportunities for improvement are, and then work to develop that theory of change, saying that I want to make a change to this outcome. There's a huge need for cause in our state. How can I go about that? Then thinking, what activities could impact that change, and really figuring out the best way to implement those activities, or to work with your very knowledgeable subcontractors to do this. So again, this all doesn't fall on you. You do have the supports, you have task, you have the Telligent team, others to help think about identifying what specific activities those may be. But it's all really starting with the data and tying that to the activities that you'll then want to do. The next slide, we'll talk a little bit about the idea of cohorts. And so we've mentioned this. This isn't something new this isn't anything new for the Flex program. It's something that a lot of states have been doing for a long time, maybe not calling them cohorts specifically, but doing projects with a subset of their hospitals. So many states, have cohorts. They had them during the QI project that we did a few years ago, or have done them for a long time. But you really want to make sure, that folks are seeing this as something that's really accessible, and encouraged to start thinking about this in planning for your NOFO and in future years, just a really accessible way to, you don't have to do activities with all of your hospitals, but really using the data to pick out which ones might need it the most, but also there's that in between of seeing who's really wants to be engaged with those activities. And so first is, what we just talked about, developing an idea for an activity based on needs. So using the data to see what areas you want to work in, and then how can you frame an activity in that topic area. Then really putting a lot of thought into what facilities have that shared characteristic, so that they have opportunities for growth in a certain measure. Maybe they're struggling with EDTC or HCAHPS or some of their financial indicators. They're on the financially vulnerable list. Maybe they're concerned about their EMS viability in their communities, or they're working to develop screening tools for health-related social needs. You want to find something in common with all of them. But there's also an opportunity to work with facilities that have complementary characteristics, and so some that are struggling and pairing them with some that are high performers. It really depends on kind of the work that you're doing and what you're doing, but there's definitely that benefit for sharing best practices, and that's really a huge benefit of what cohorts are meant to do. So once you have that group really working with to implement a same or similar activities, you might work with hospitals on swing beds. So that's kind of that same topic, but each facility might work on things a little bit differently, or they might work on different measures for swing beds, and that's okay. It's really just bringing them together to work together on the same topic and learn from each other and alongside one another while you're trying to support them in doing so. And it's important to provide kind of those touch points for the cohorts in that model, those opportunities to get them together, to share information about how they're struggling, what they've figured out that really works at their facility, or best tips and tricks and best practices, and really learn from one another. And then finally, it's that data component. So it's collecting that data at the beginning from those participating hospitals in your cohort, really in the middle, as that makes sense, it may not. And then at the end, and comparing, what changes can you observe? I want to, think about how you're setting these up and just making sure that you are getting the data from them. It's really great to be able to compare them and then really look and see what may have done differently in that cohort and really how things worked and how that might work in future projects. I want to take one more time just to ask briefly if there are, actually, we're going to skip that because I think we're low on time. We can go to the next one, Tracy, just analyzing data. So this doesn't need to be as difficult as it might seem. This is, I think, something that seems daunting oftentimes. First, it's really ensuring that you allow enough time to see a change in the data. So if you have intermediate or long-term outcomes that you're looking at, you won't see that within a year. So when you're developing a project, it's okay to acknowledge that you anticipate having a multi-year project to look at outcomes over a longer period of time. Don't try to collect data that shows change in a long-term outcome within one program year. It's not going to work. You're not going to see that change. And then keeping things simple. So compare your baseline to your final data. That's at the end of the year, the end of the project period, see what change there has been. And then take that information on the change and think about what's happened. Think about any differences. Were some participants more engaged? Was there turnover at a facility? What were those other contributing factors that may have made an impact on kind of how your implementation went? And really just think about, how you'd use that to change things in the future and learn from what you see in that data. And then the last slide here is just using the data to build on activity. So this is a great visual that walks through a PDSA, a Plan, Do, Study, Act cycle. And so through this, it's really important to monitor those measures. So use the data so you can course correct, whether that's mid-year or that's between years if you're planning to work with a cohort on a similar topic again, or just in how you facilitate things generally. Use that information to improve in the future. Think about how projects can build over time. It's a big cycle. What's the overall goal for each program area? How can you really have a project contribute to that goal? And just that constant process of identifying the needs with your data, monitoring the data for change, whether that's good or bad, analyzing how everything went, and then using that to move forward. And I know that was a whirlwind, but I think now we're going to take a chance to apply that a little bit.
Yeah, thanks, Megan. I appreciate that. So, and thank you, Scott and Sandy, for being ready to share examples too. We really appreciate your help and contribution. So we're going to move into some small group exercises like we've done in some of the previous ones. So we're going to randomly shuffle you all out into breakout rooms. And in those rooms, there'll be someone from Task or the Flex monitoring team there to help kind of facilitate. You'll look at some data that's on the screen, and then as a group, you'll walk through some responses to 7 questions that are prompting you there about what you see. And we'll help guide you through that. We'll be sharing our screen, and we'll so you don't need to log into Mural, and we'll help type in the answers that your group comes up with too. We'll just have 10 minutes only in the breakout rooms so that we can come back and share with one another and close out our event today, talk about what happens next after today. So Caroline's going to shuffle us all into breakout rooms, and we'll look forward to talking with you there. Welcome back, everybody. We recognize that you probably did not quite get finished with that. So what we can do, we'll think about a creative way to get a screen capture out, at least in one of the rooms too, so you can at least ponder the rest of the questions, reflect back on what your group was talking about, and ponder the rest of the questions. But we hope that was a beneficial exercise to you all. I'm just going to share my screen here quick again to close us out. So a continued thank you to Megan and John as they help us with providing their expertise in these webinar series. We really, really appreciate it. Their contact information is there for you on the screen. They're just a wealth of knowledge that we turn to all the time too. So please do reach out with questions. And then lastly, just about what's coming next. I'm not sure if our closeout polling is available. So if it is, okay, it's frozen. So we are being nimble at task too with not getting all of our evaluation information today, and that's just what it is. But a little bit about what's coming up next. So the next webinar for you all is after the turn of the calendar year. We'll get a little bit further into what we did today with designing activities and practice some of the stuff that we talked about in a previous webinar about describing output and outcome measures. So look for that on January 9th, Tuesday the 9th in the afternoon. There is a feedback form that's linked there, collecting some information just about how is this series going so far? What else do you want to know about from evaluation? So we'll be sure to also, if you don't click on the link right there, send that link to that survey out when we send out the recording to all of you as well. And as we enter into grant writing time or cooperative agreement writing time, please reach out to any of our resources at TASC, through the Flex monitoring team, certainly through the team at Arquita, and to your project officer as well for anything that you need as we enter into the next few months of writing time together. Thank you all so very much for joining today, for participating in the conversation. We really appreciate all of you, and we look forward to talking with you again soon.